There's these really main identities that a lot of us think about most often, surrounded by a lot of other forms of identities. So as you look at it, which identities do you think about the most often for yourself? Which section do you think forms most of your self-identity? And this changes a lot depending on time and situation. Yeah. So anyone want to share what their current main one is? I think for me, mine, would be, oh gosh, it's actually hard to pick just one. So, anyways, I won't make people say this out loud. I changed my mind. Something to think about though, because part of cultural humility that we'll talk about later is knowing yourself, doing a lot of self-reflection on your own identity, your own power, your own culture, and your own biases.
An example of that being like International Women's Day was this week.
Yeah.
So I think a lot about gender. I think a lot of a woman rights are really proud of that day, and so I think it changes even the day or the week depending on what's going on.
Absolutely. Yes. Okay. Culture, identity, and power have an interplay. So, as cultural differences increase, identification with the dominant culture decreases. When we say dominant culture, what does that mean? Anybody? Jeannie?
The one that's considered the norm wherever you are at the
Yes.
moment.
Is it necessarily the culture with the largest number of members? No. So, you're right, thank you. So the dominant culture is not necessarily the largest culture in an area, but it's the one that has the most power, it's the one that can set the norms for the area. What would be a good example of a culture that was dominant but not necessarily the largest?
The South during slavery, for sure.
Yeah.
The British in India.
Yes. Yeah. Good. So, as cultural differences increase, identification with dominant culture decreases. The more different you are in your culture from the dominant culture, you identify with that dominant culture less because the gap increases, the gap of differences increases, so you can identify with them less. However, the less you identify with the dominant culture, the less power you have in society. Is there like a marker or something I can have
Here,
to
right
sort
around
of
the corner on the table.
illustrate? So cultural diffs are going to go this way. And this way is going to go ID with, I think it's really hard for me to spell and talk at the same time, so if that's not right, I apologize. Okay. So, we have cultural differences going up this way, identification with the dominant culture going this way. So the more differences there are, the higher you get on this side. Make sure I do this right.
You're gonna wanna create like
This
a
way.
line, no, this way, because,
You're gesturing this way. Yes, audience participation.
okay,
Thank
awesome.
you.
So-
I know what I'm saying, but it's hard for me to illustrate with my brain.
Yeah.
Okay, thank you, yes. So the greater the cultural differences, the less the identification with the dominant culture. Now, is it okay if I use more than one page?
Yes.
Okay. I don't think I've ever used these before, but I've always wanted to, so thank you for this opportunity. All right, so now we have ID with the dominant culture going this way, and we have power going this way. What direction is it going?
The opposite.
This way, yes. Okay. So, all right. The less you identify with the dominant culture, the less power you have. The more you identify with them, that means the less cultural differences you have, so the greater the power. So, this shows the dominant culture in the US right now. A couple different identity categories there. So, in thinking with that in mind, with that being as the dominant culture, so the most powerful position, think about what differences you might have with that dominant culture, what differences your clients and families might have, and how that affects your interactions with them, how it might affect your interactions with, or their interactions with doctors, with school teachers, with case managers, the general society around them. And again, this is something that is good to self-reflect about, to be aware of. So, cultural humility is a respectful attitude towards individuals of other cultures that pushes one to challenge their own cultural biases, realize they cannot possibly know everything about other cultures, and approaches learning about other cultures as a lifelong goal and process. How many of you, show of hands, have heard about cultural competency? Okay. What do you think the difference is between cultural competency and cultural humility?
This feels like more that I acknowledging more that I don't know.
Yeah, it's really good. Cultural competency is gaining a lot of knowledge about other cultures, learning as much as you can about other cultures, which is good. It's very important. Cultural humility is about recognizing that you are not the expert in someone's culture, and you don't know all the right answers for them, and being willing to listen and learn and partner with them in whatever various issue you might be navigating. Some of the key principles of cultural humility are gentleness, kindness, and patience. And I switched those icons. Patience should be under the hourglass. Just realizing that now. All right. So your role as a helper with cultural humility is to combine both cultural competence and cultural humility. It's absolutely important to know as much as you can about the cultures that your clients, that your families come from. It's also important to combine that with cultural humility. Cultural humility is not necessarily just like a checklist you have to go down to make sure you have everything. It's a constant orientation towards the other person and not necessarily your own interests or priorities or what you think is right or ethical or should be done. Again, to position yourself as a learner and not an expert. Kind of what we talked about in the first session of listening to understand and not to fix. Taking time to recognize your biases so you can keep them in check. And so talking about our identities, our power, our culture, recognizing where we are in that so that we can recognize our biases and do some self-reflection and keep those in check during our interactions. As much as possible, we are all human and we are all biased. Approach working with newcomers from a place of gentleness, kindness, and patience. We mentioned that. And communicate with newcomers in a way that conveys safety and choice. So, especially when we're working with folks that have experienced trauma, safety and choice are very big. And we talked about that some in trauma-informed case management. And these cultural humility is very much intertwined with trauma-informed case management. Whenever possible, giving folks the chance to have choice, have some participation in the work that you're doing with them and things that are happening around them, appointments that they have, treatment plans that you create, decisions that you're making, and safety. Knowing that you are a safe person who isn't going to force them into a situation they're not ready for or comfortable with, that they're in this culture, that I don't know where they might be on the spectrum of identification with the dominant culture or the spectrum of power in relation to the dominant culture, but recognizing that safety might be a really important and predominant thing for them. So the 3 tenets are to learn, partner, and advocate. Learn from them, listen to them, actually hear what they're saying, hear what their priorities are, how they are understanding a situation, what their perspective of the situation is, partner with them in helping them to reach their goals and advocating for them. A lot of folks don't have the training or education or awareness of other cultures and how they operate, so advocating for your families and for your clients is a really big deal. And it helps with that safety because then they learn that there's someone that will advocate for them that they can trust. Next. Some more simple ways to build trust and rapport. Stay aware of and in control of your facial expressions and language. My facial expressions are hard for me to control in Zoom meetings. I often turn off my camera just because I catch a glimpse of my face and realize that that's not appropriate, even if I might not be saying anything. So facial expressions and body language are a thing. Not only to be culturally competent, to know like what body language or gestures and things might be appropriate in someone's culture, but also to make sure that sometimes Americans can seem a little aggressive in their body language, like we can stand too close or talk too loudly or do too much eye contact. So just being aware of that. Lean into difficult conversations with a full heart and an open mind. There might be some things with your clients and your families that they choose to do that you really don't agree with at all. Maybe they choose not to, they decide they are just never comfortable taking the bus. It's not something they want to do, it's not something they're comfortable with. Maybe they decide that someone in the family, one of the parents, isn't going to work for whatever reason. Maybe they decide not to undergo a medical treatment that we think that their doctors think that they might need. All of these are things that might play into their culture and their beliefs and their perceptions of the world and gender roles and family norms and all of the things. So being willing to have conversations where we are listening to and understanding them and not forcing our perceptions and beliefs on them. And acknowledging when you don't know something. That's a big one. I don't know, but I'll find out. Connect before you correct. Again, listening to hear and understand, not to fix. Validate, affirm, and normalize. Let's see. I think this would go back to the listening to understand their perspectives. Affirming that, okay, I can see that this is really important to you. I can see that this is a big issue. You said that you're not going to work because you feel like you are going to stay at home and take care of the children. You told me that's really important in your culture, and I respect that. Practice boundaries. Someone, yes,
So normalize.
yes.
Give me an example of that.
Ooh. To normalize it,
Well, I mean, looking back to that example that you had is, I'm gonna stay at home, I'm gonna take care of the kids, that's my culture. Normalizing it means accepting it, not bringing it up again, and accepting, yeah, that is the situation, and that's the situation you're gonna walk into each time, so it doesn't have to be revisited.
yeah,
That's one, that's good.
and putting it within the framework of their culture. Like, maybe it's not normal here in the US, but for their culture it is.
Yeah.
Seems like that also has to do with their feelings. A lot of like I know you want to take care of your family. I want to take care of my family too. Like, or we don't know whether people should
Kinda
cross
like
the border,
it's
but
just empathizing with them.
empathizing.
I hear
Yeah.
you. Yeah, I
One-
see that it's not so clear
Yeah,
cut. I understand where you're coming from,
yeah.
normally.
Are you able to do both, accept and validate, affirm, normalize, and yet when you know that in order to survive here and pay rent, for instance, the income isn't enough without working? Or
It's a good question.
that's always the dilemma, it
Yeah.
seems like the bus, I just struggle with that.
Yeah.
Because, yeah, I get it, you don't wanna ride a bus, but you do have to go to work. I mean,
Yeah.
one guy told me, in the area that, many people are housed, he felt safer that Walmart, I guess it's closing now, but, walking home at 11 o'clock at night, he felt safer doing that than another job where he would be required to ride the bus because he had been, threatened with a knife at the bus stop. And, so a woman saying that
Yeah.
is even more understandable, but that seems sometimes difficult.
Yes, that's an excellent question. That's something that we run into a lot in working with newcomers. It's the dilemma between what we think needs to be done for survival and what the client wants or believes or needs to do. And so yes, I think there is a way to talk with them about that situation with cultural humility and understand their perspective and their why and their reasons. And as someone who's working with a family, you can say, this is the situation, this is what I think needs to happen, let's have a conversation about it, and see if there's a way that I can help facilitate this for you. You can talk with them about the situation to impress upon them what you think the need is for a certain thing. At the end of the day, it is their life.
Oh, yeah.
And that's the tough part of working with other humans sometimes. Practicing boundaries comes in. that. We aren't responsible for saving anyone, including ourselves. Yeah.
In our, where we're housing people coming out of jail, out of detention, what I've found is inviting them to help with the remaking of beds or the sweeping of the area or keeping things clean. You know, they've been told exactly what to do and was done for them. And to just invite them to have some agency in keeping their place clean. I just find it sort of help to build relationship instead of feeling incapable, you know, that they have nothing to do, they have to just receive, but they can give. And since we started doing that, our guys are just so much happier. They have something to do that's normal. And sweeping the floor for them is normal.
Yeah.
So making up food is normal. And just letting them be normal.
Yeah, that's wonderful. Thank you. Yeah, helping to develop some self-sufficiency, giving them some ownership of the place that they're staying in, helping them. Some folks, I had a conversation with a client just this morning where he was telling me being in the Wings program was extremely difficult for him because he doesn't like asking for help or receiving help, and he's used to being very independent and self-sufficient in his country of origin, and this was really hard for him. And so having that chance to involve your clients to where they're able to give back a little bit, that's really cool. Next. So, cultural humility examples. On the left, we have some cultural factors, groups, segments, I forget the term. And on the right, we have some situations. Feel free to read through those, and then we're going to see if we can match the two sides to the correct things. What do we think for the first one? A woman refusing to see a male doctor. What section do you think that might be under? Okay.
Tradition and spiritual.
Leave your relationship.
All right. Okay. For the second one. Yeah, I think hierarchy and status, saving face, like not wanting to say no. Okay, a patient who has wellness needs, physical or emotional, psychological, but the only treatment they want is for their shaman to bring traditional medicines. That's an easy one. All right, a client decides to forego medical treatment. She says, if I die, I die. You guys are so good. All right, the client coming an hour late for their appointment. That never happens, does it? What was that?
Hierarchy starts formality.
Yeah, possibly. I think about it being more relationship oriented, like maybe they were in a conversation with someone and rather than leave that person to go to their appointment, they finished what they were doing with that person. It's a little bit of a different concept of time.
In working with African families, they think if you say it's 2 o'clock, it's any time in that 2 o'clock hour. It's driving me crazy. 2 o'clock is 2 o'clock.
It's still
2:58.
It's 2 something.
So it's too big.
I get that.
Hour.
All right, next please. Yes, so these are the connections. I think we got all of them right. And hey, things can also definitely be more than one. Like we were saying, there's more than one right answer. It's all a big blend of factors. That was the word. Okay, now you can go to the next one. Okay, thank you. In all the different languages,